Hi guys! Welcome to part 3 of our 200 most common questions for physiotherapy examinations. This is a 20 question video. Let's start. Question number 41. Significant losses to eyesight can reduce quality of life and threaten ability to live independently at home and in the community. There is a general decline in visual activity. Gradual prior to sixth decade, rapid decline between ages 60 and 90. Which of the following is not a symptom of vision loss? A. Decreased pupillary responses, size of resting pupil increases. B. Decreased ability to adapt to dark and light. C. Decreased sensitivity of corneal reflex, less sensitive to eye injury or infection. Or D. An attached retina. And the answer is letter D, an attached retina. Let's go to the next question. Question number 42. It is important for persons to give care to older adults to understand how age affects the eye, recognize the most common eye problems, and learn ways to deal with poor eyesight. Which one of the false ways to come over this? A. Avoid the usage of vitamin A. B. Work in adequate light, reduce glare, avoid abrupt changes in light. C. Assess for use of glasses, need for environmental adaptations. Or D. Use warm colors for identification and color coding. And the answer is letter A. Avoid the usage of vitamin A. Let's go to the next question. Question number 43. Pathology is the study of diagnosis of disease through the examination of organs, tissues, bodily fluids, and whole bodies. Pathology also encompasses the related scientific study of disease processes called general pathology, which is not a reason in the following that causes loss of vision due to pathology. A. Senile macular degeneration. B. Parkinson's disease. C. Meniere's disease. Or D. Onchocerciasis. And the answer is letter A. Senile macular degeneration. Let's go to the next question. Question number 44. The ability to hear clearly declines with age. Hearing loss often begins at a young age and progresses slowly during the 20s, 30s, and 40s. Most people do not notice hearing loss until they are in their 50s or 60s, when they begin to have a hard time hearing high-frequency sounds. Which of the following is not a symptom of hearing problem? A. Significant changes in sound sensitivity, understanding of speech. B. Minimal degenerative changes of bony joints. C. Buildup of cerumen may result in conductive hearing loss. Or D. Oculomotor responses diminished. And the answer is letter D. Oculomotor responses diminished. Let us go to the next question. Question number 45. Family caregiver service providers and healthcare professionals often feel frustrated when trying to communicate with an older person who cannot hear well. Listening and following a conversation is tiring for someone with poor hearing. Which is not a hearing loss from the following? A. Parkinson's disease or Alzheimer's disease? B. Sensorineural? C. Presbycusis? Or D. Conductive? And the answer is letter A, Parkinson's disease or Alzheimer's disease. Let's go to the next question. Question number 46. Inappropriate actions based upon misinformation can lead to a feeling of paranoia. When older persons fail to answer when spoken to, or if they give inappropriate answers to questions, they are sometimes considered confused or demented. Significant loss of hearing can cause older adults to feel cut off from friends and family, which is one of the false ways to come over the hearing problem. A. Measure air and bone conduction, Rhine test, Weber test. B. Determine use of hearing aids, check for proper functioning. C. Avoid maskers. Or D. Orient person to topics of conversation they cannot hear to reduce paranoia, isolation. And the answer is letter C, avoid maskers. Let's go to the next question. Question number 47. Pathology is the study and diagnosis of disease through examination of organs, tissues, bodily fluids, and whole bodies. Pathology also encompasses the related scientific study of disease processes called general pathology, which is not a reason in the following that causes loss of vision due to pathology. A. Hypothyroidism. B. Paget's disease. C. Autosclerosis. Or D. Glaucoma. And the answer is letter D, glaucoma. Let's go to the next question. Question number 48. Vestibular balance control shows degenerative changes in otoconia of utricle and saccule, loss of vestibular hair cell receptors, decreased number of vestibular neurons, which is not a factor of age change in vestibular balance control. A. Reduced function of vestibular ocular reflex. B. Altered sensory organization. Older adults more dependent upon somatosensory inputs for balance. C. Postural response patterns for balance are disorganized. Or D. Increased thresholds in vibratory sensibility. And the answer is letter D, increased thresholds in vibratory sensibility. Let's go to the next question. Question number 49. The human balance system depends on the inner ear, the eyes, and the muscles and joints to transmit reliable information about the body's movement and orientation in space, which is the disease not caused by additional loss of vestibular sensitivity with pathology. A. Cerebrovascular disease. B. Cerebellar dysfunction. C. Presbycusis. Or D. Benign paroxysmal positional vertigo. And the answer is letter C, presbycusis. Let's go to the next question. Question number 50. The somatosensory system is a diverse sensory system comprising the receptors and processing centers to produce the sensory modalities such as touch, temperature, proprioception, and nociception. The sensory receptors cover the skin and epithelia, skeletal muscles, bone and joints, internal organs, and the cardiovascular system. which is not a leading aging change due to somatosensory aging change? A. Proprioceptive losses, increased threshold in vibratory sensibility. B. Cutaneous pain thresholds increased, greater changes in upper body areas. C. Loss of joint receptor sensitivity, losses in lower extremities, cervical joints may contribute to loss of balance. Or D. Loss of power. And the answer is letter D, loss of power. Let's go to the next question. Question number 51. The somatosensory system consists of ascending pathways from the body to the postcentral gyrus in the cerebral cortex, namely the dorsal column medial lemniscal pathway, the ventral spinothalamic pathway, ventral and dorsal spinocerebellar tracts. Areas of the part of the human brain map to certain areas of the body, dependent on the amount or importance of somatosensory input from that area, which is not a disease caused by a disorder of somatosensory system. A. Autosclerosis. B. Diabetes, peripheral neuropathy. C. CVA, central sensory losses. Or D. Peripheral vascular disease, peripheral ischemia. And the answer is letter A, autosclerosis. Let's go to the next question. Question number 52. As mentioned above, areas of the part of the human brain map to certain areas of the body dependent on the amount or importance of somatosensory input from that area, which is not a compensatory strategy to recover somatosensory system. A. Use touch to communicate, maximize physical contact. B. Allow extra time for responses with increased thresholds. C. Maximize air and bone conduction. Or D. Teach compensatory strategies to prevent injury to anesthetic limbs. False. And the answer is letter C, measure air and bone conduction. Let's go to the next question. Question number 53. As the disorders of smell and taste are rarely life-threatening, they may not receive close medical attention. Yet, these disorders can be frustrating because they can affect the ability to enjoy food and drink, and to appreciate pleasant aromas. Which one of the following can be a reason for taste and smell disorder? A. Head injury. B. Leg injury. C. Diabetes. Or D. Headache. And the answer is letter A, head injury. Let's go to the next question. Question number 54. Although our sense of smell is our most primal, it is also very complex. For humans, odors communicate a variety of messages, depending on the odor and the person receiving it, which is not a clinical implications or a compensatory strategy to prevent smell and taste disorder. A. Older adults frequently increase use of taste enhancers. B. Decreased home safety. C. Examine ability to identify odors, tastes. Or D. Increased food to enjoy food and taste. And the answer is letter D, increase food to enjoy food and taste. Let's go to the next question. Question number 55. Most common mental disorders affect cognitive functions, mainly memory processing, perception, and problem solving. The most direct cognitive disorders are amnesia, dementia, and delirium. Cognitive disorders are mental disorders that develop on the basis of cognitive mental disorder perspective, which is not an age-related change in cognition among the following. A. Decline in measures of intelligence occur in the year immediately preceding death. B. By age 39, require longer times to complete tasks. C. Impairments of memory are typically noted in short-term memory, long-term memory retained. Or D. Changes in intellectual abilities typically show up till mid-60s. And the answer is? The answer is letter D. Changes in intellectual abilities typically show up till mid-60s. Let's go to the next question. Question number 56. Learning is acquiring new knowledge, behaviors, skills, values, or preferences. It may involve processing different types of information. Learning functions can be performed by different brain learning processes, which depend on the mental capacities. Which of the following factor is an obstacle in learning for the older people? A. Dentures. B. Increased cautiousness. C. Anxiety. Or D. Interference from prior learning. And the answer is? The answer is letter A. Dentures. Let's go to the next question. Question number 57. Lifelong learning is the process of keeping your mind and body engaged, at any age, by actively pursuing knowledge and experience. The pursuit of knowledge through lifelong learning has wonderful benefits for adults 50 plus. Which of the following factor is not responsible to intervene to slow changes or enhance learning in older age? A. Increased mental activity. B. Improved health. C. Reduction of stress, counseling and family support. Or D. Isolate from crowd. And the answer is? The answer is letter D. Isolate from crowd. Let's go to the next question. Question number 58. The cardiovascular system is a closed tubular system in which the blood is propelled by the heart. The system has two circuits, the pulmonary circuit and the systemic circuit. Each circuit has arterial, capillary, and venous components. It is essentially a long, closed tube through which blood moves in a double circuit, one through the lungs and one through the rest of the body. Which one of the following is an age related to cardiovascular disorder? A. Cardiac valves thicken and stiffen. B. Degeneration of heart muscle with accumulation of lipofuscins. C. Altered pulmonary gas exchange. Or D. Decline in neurohumoral control. And the answer is? The answer is letter C. Altered pulmonary gas exchange. Let's go to the next question. Question number 59. The cardiovascular system is formed by the heart, arteries, and veins. In connection to the respiratory system, The cardiovascular system provides oxygen to cell and collect carbon dioxide. It also helps on the transportation of hormones, wastes. It is responsible for the circulation of the blood that carries all the substances to and from the cell. With the blood circulating, the temperature of the body is also affected. Which of the following is not a correct clinical implication for cardiological system? A. Blunted, decrease in heart rate acceleration, decrease maximal oxygen uptake and heart rate. B. Respiratory responses to exercise similar to younger adult at low and moderate intensities at higher intensities. C. Decreased stroke volume due to decreased myocardial contractility. Or D. Orthostatic hypotension. And the answer is letter B. Respiratory responses to exercise similar to younger adult at low and moderate intensities at higher intensities. Let's go to the next question. Question number 60. The integrated system of organs is involved in the intake and exchange of oxygen and carbon dioxide between an organism and the environment. In humans, the diaphragm, and to a lesser extent, the muscles between the ribs, generate a pumping action, moving air in and out of the lungs through a system of pipes divided into upper and lower airway systems. Which one of the following is not a pulmonary system age-related disorder? A. Loss of lung elastic recoil, decreased lung. B. Changes in blood vessel. C. Forced expiratory volume decrease. Or D. Blunted defense or immune responses. And the answer is letter B. Changes in blood vessels. Thank you so much for watching the part 3 of our 200 most common questions. See you on part 4.